Thank you so much for joining us for 13 News at 10. I'm Samantha Soto. First tonight, thousands of people across the country honored National Burn Awareness Week this week. It's a chance to unite and promote burn prevention and awareness within communities. 13 WREX's Bailey Bozen is with us now with a touching story tonight. And Bailey, you spoke with someone who is a burn victim.
While we are at the end of Burn Week, the American Burn Association works to ensure burn units and survivors can continue the advocacy, not just this week, but year-round. I spoke to a survivor who knows why it's so important to raise awareness for this firsthand.
Safety has made burns unusual, but when they do happen, they can change your life in a minute.
Timothy Gould burnt over 93% of his body, sustaining mostly third and some second-degree burns.
It was July 2001, and I was using a acetylene torch and vapors from a barrel ignited, and I was taken by ambulance to the local CGH hospital in Sterling, then flown later to Loyola Hospital, where I spent 8.5 months.
After 10 months of hospitalization and rehab, his nurse said he would live a normal life, but it would be a new normal.
That's exactly what it is. You learn that your life has changed, and you can't do the things that you used to do, but I'm able to do a lot of things, like I do a lot of woodworking.
Dr. Carson, medical director of the Loyola Medicine's Burn Center, shares that both Loyola and the American Burn Association have learned that connections can go a long way.
We really emphasize connecting survivors with people who are suffering from burn injuries.
Following recovery through Loyola and the ABA, Gould was asked to return and speak with patients.
The hardest thing for them was going back into society and their physical looks and dealing with society.
For both Dr. Carson and Gould, the trauma of burns can sometimes lead to something incredible.
People often ask me, how can you do this? You've seen such terrible things, but I'm also seeing people's incredible responses to these things, which are as beautiful as the damage is ugly.
It seems like the little things in life mean a lot more to you than the bigger picture, and that was the biggest change.
Even outside of Burn Week, burn units across the United States exist to ensure a patient receives the best care.
We help create standards for each other, we learn from each other, and just sort of rally around, this problem. It's rare, but when it happens to you, it takes your whole world over. And that's why burn centers exist.
The ABA and burn units also work to make sure survivors always have support.
If we want to take care of the patient, the way to do that is to integrate the family and help them, help the person through this.
I had the best medicine you can have when I would see 6 little feet come down the steps in the morning.
Gould says the accident strengthened his faith and family and encouraged him to connect with survivors and advocate for patient consent.
Even though it was a tragedy, I have many blessings in my life, and I've met a lot of good people that have helped me.
Dr. Carson sharing that it is an exceptional need to have a burn injury. What you need to get better is immense.
It's nice to see that in this world, people still like to come together and give people that.
Have more about Burn Week and how you can promote burn prevention with this story on our website, WREX.com. Back to you, Sam.
Definitely a powerful story there. Thank you, Bailey.